So think about this for a second. How do you completely transform public health care for more than 1 billion people? It sounds impossible, right? Well, today we're diving into one of the most ambitious health initiatives ever attempted, India's National Health Mission. Let's get right into it. I want to start with just one number, 254. Back in the early 2000s, this was India's maternal mortality ratio. So what does that mean? It means for every 100,000 babies born, 254 mothers died. It's a staggering number, and it pointed to a really deep, really urgent crisis. And that really brings us to the heart of the whole story. When you're facing a problem on that scale, a challenge that massive, where do you even start? Seriously, how do you build a system from the ground up that can actually reach every single village, every slum, and save lives? To really get the solution, you've got to understand the full scope of the problem. Because back in the early 2000s, India's public health system was just buckling under the strain, especially for the people who needed it most. The crisis was kind of two-sided. On one hand, you had these tragically high death rates for mothers and their babies. But on the other hand, you had this huge gap in just getting basic health care. If you lived in a rural area, you were pretty much on your own. So, the problem was clear. The crisis was real. The country needed a solution that was just as big, just as ambitious as the problem itself. And this is where the National Health Mission steps onto the stage, ready to tackle this thing head-on. The whole journey kicked off on April 12, 2005. That's when the National Rural Health Mission, or NRHM, was launched. And its focus was laser-sharp. Get good, affordable healthcare to the people in the countryside, where the need was absolutely the greatest. And look at these goals. They were aiming for the moon here. This wasn't just about one thing. Of course, they wanted to slash those infant and maternal death rates, but they also wanted to give everyone access to healthcare, get diseases under control, and even work on population stabilization. This was a total system overhaul. But a plan that big is just words on paper without people on the ground making it happen. And the real genius of this whole mission, I think, was the creation of a brand new grassroots workforce, the actual foot soldiers, connecting communities to care. So let me introduce you to the ASHA, the Accredited Social Health Activist. An ASHA is a trained woman who actually comes from the local community she serves. She becomes the go-to person for about 1,000 people, that trusted, crucial link between her neighbors and the official health system. And her job is, well, it's everything. She's a teacher, raising awareness about nutrition and health. She's a counselor, talking about sanitation. She can give first aid for small things. She holds on to the medical kits. And she's the one who gets the whole community motivated to go to the clinic. She is, without a doubt, the backbone of this system. Now, one of the smartest tools these ASHAs had was a program called Janani Suraksha Yojana, or JSY. It's such a brilliant idea. Basically, it gives women cash assistance to encourage them to give birth in a proper health facility instead of at home. It directly links financial help to a safer birth. The success in the villages was amazing, a total game changer. But India is a country of massive, sprawling cities too. For this to be a truly national mission, it had to grow. It had to evolve. So, you've got the rural mission kicking off in 2005. Then, 8 years later, in 2013, they added the next big piece, the National Urban Health Mission. Put them both together, and you get the National Health Mission, or NHM, that we have today, this giant umbrella covering everyone, no matter where they live. And these two arms, they have different jobs, but they work together. The rural mission is all about building up the infrastructure, the clinics, the supply chains, in far-flung places. The urban mission? It's focused on the unique challenges of the cities, especially getting primary care to the urban poor living in slums. All right, so we've seen the plan, we've met the people on the ground, we've watched it evolve. But here's the billion-dollar question. Did it actually work? Okay, let's look at the numbers, because the results are, well, they're pretty incredible. Let's talk about one of the biggest wins. Remember that number from the beginning, 254? Well, by 2019, it had plummeted all the way down to 103. That's not just a statistic. That represents tens of thousands of mothers' lives saved year after year. It's just amazing. And the story for babies is just as powerful. Back in 2005, the infant mortality rate was 58 for every 1,000 births. By 2019, it was down to 28. They cut it by more than half. I mean, that is a monumental victory in public health, plain and simple. And the good news just kept coming. The overall fertility rate dropped, the rates of diseases like TB fell, and that JSY program, it's now helping over 10 million pregnant women every single year. The scale of the success here is just hard to wrap your head around. But of course, the work is never really done. The mission now has to adapt to a whole new set of challenges. That means they've got to keep strengthening those local health centers, figure out how to improve care for the urban poor, and now tackle the growing threat of diseases like diabetes and hypertension. And that really leaves us with one final big question to think about. As India gets better and better at fighting infectious diseases and saving mothers and babies, a new reality sets in. So what's the next great public health mountain for this modernizing nation to climb? That, right there, is the challenge for the next chapter of this health revolution.